Labor and delivery is a marathon. It is not typically a sprint. Now, some people, the lucky ones get the 2 or 3 hour labors and they are lucky, but it's usually work. There are 2 expectant mothers visiting with me this morning. I'm gonna get this baby out so you can have more time with him. Yes, all right, very good. One is a middle school PE teacher, so she's very active, always running around, always doing something. And the other one works in Topeka and she has a desk job. So they have 2 very different jobs, but they are both very active mothers, which does help during labor and delivery if you're active throughout your pregnancy. All right, so first we're just gonna check out your SI joints, see how they're moving today. When you're pregnant, your body releases relaxin, which you need because it helps loosen everything up for delivery, but it also makes things all loose. And so your ligaments are loose, so your pelvis doesn't stay in place very well. And if one side of your pelvis is rotating forward, then the other one by nature is gonna rotate back. And what that does is it constricts the birth canal. And if that birth canal is constricted, then baby can't come out. So we keep the pelvis in alignment, we keep the sacrum in alignment, we keep the birth canal where open, and babies come out a lot easier. When you're working out, do you ever notice any looseness in your pelvis? Like, does it feel like it's shifting or moving?
I've noticed a little bit of loosening up, but that's mostly just from walking.
Okay.
And I've tried using a support belt when I've been walking.
Okay. Typical patient, pregnant patient who's coming in 24 to 28 weeks is very common. And our first goal is to get them out of pain. Okay, so we're using the drop table on you today. So as I adjust your sacrum, the table's gonna drop out from under you. And so it's gonna be a little bit loud, but don't be startled by it. All right, here we go. There we go. And that just helps get things moving a little bit easier here. Well, there's a lot of pressure put on expectant mothers about how things should go and how things should be by just society in general. Their parents, their siblings, their medical doctors. It's hard, you know, it's a marathon. You're getting ready to run a marathon, and a lot of times they're not well equipped with what that really means. And so they end up having interventions that they don't want because they're not relaxed with the process. And I try to educate them about how to be relaxed during the process of birth, because it's hard, it hurts, but it's over. And they can do it. Women are amazing. Our bodies are amazing. This is what we were meant to do. They can do it. They just have to trust their bodies, and they haven't been taught how to trust their bodies and to listen to the cues that they're given and to just go with what's happening. So that's what I try to do